Hello, my name is Stephen Lester. I'm a board certified psychiatric nurse practitioner. I currently live here in Southwest Virginia. I've lived in the central Appalachian region for all my life. I've worked in spiritual care, hospice, substance abuse, grief, rehabilitation, and psychiatric services all of my adult life right here in the mountains of Appalachia. Welcome to the Appalachian Mountains. Appalachia is a beautiful, wonderful, rugged area. Though Appalachia is so amazingly beautiful, it's also plagued with chronic substance abuse. In fact, substance use is higher in Appalachia than the nation, with a 64% higher overdose rates for certain age groups. For the people who live here, this is no surprise. You'd be hard pressed to find a person that has not lost someone to substance use or has not been affected in some way. I grew up hearing my share of folklore or old wives' tales. I was cautious about walking under ladders, breaking mirrors, watching red birds, exiting the door you entered in, and black cats crossing the road. Among these tales, I would hear of generational curses, or that the apple didn't fall from the tree type statements. In my clinical practice and observing my area, I can say that substance use has a powerful element of family patterns. I often wondered how odd it was that people would often repeat the mistakes or take on a lifestyle of their dysfunctional families, including substance use. Now we understand that cycles of behaviors do repeat in families due to very real psychological, social, and biological factors. I want to be clear that research does not show that people are biologically wired to be substance users. A person is not just born that way. However, we as people learn in a variety of ways. One way is observational. We learn how to act or what is acceptable through exposure. It's easy to see how observing someone using substances can indirectly influence a child or adolescent to copy that behavior or at least normalize it. Another type of learning is called social learning theory. It's a complex interaction of both internal and external factors. In essence, it suggests the greatest influence on behavior is the people we maintain the most intimate relationships with. In short, exposure to substance use from peers or family is a very strong predictor of future use. Is it a generational curse? Possibly. My father was a coal miner. He died at 52. I watched the later years of his life. The activities he once loved, like fishing, now were extremely difficult due to chronic pain and numbness in his arms. His case is simply a microcosm of the Appalachian area. There is a reason why opioid overdoses are among the highest in the country in the Appalachian area. People often have chronic pain and have been placed on opioids for pain management. Then the prescribing provider either moves or does not want to write prescriptions anymore. The patient is then in search of their medication either at the doctor's offices or on the street. Often these patients end up going to a medical assistant treatment clinic or MAT for opioid use disorder. I've worked in the substance abuse setting for a portion of my career as a psychiatric practitioner. I've seen this play out in families numerous times. Chronic pain also affects mental health. Depression increases as a person experiences chronic pain. In fact, chronic pain and mental health issues share a common neural mechanism. We could reasonably correlate chronic pain with increased mental health conditions. Of course, those that suffer with chronic pain, this is no new news to them. Deaths of despair, diseases of despair. Honestly, the first time I heard this term, I had a visceral reaction. I was actually sick to my stomach. Imagining having so much despair in your life as to die from it, or die from side effects of the substance used to try to cope with the despair. Diseases of despair are suicide, opioid overdose, and alcoholic liver disease. These rates are higher in Appalachia than anywhere else in the country by 43%. My son has a semicolon tattoo to honor a classmate that committed suicide. Unfortunately, one would be very hard pressed to find a person or a family that has not been affected by suicide in this area. I have experienced this tragedy in my own clinical practice. Most have been in relation to chronic substance use, whether opioids, methamphetamines, or alcohol. Suicide rates rise when there is substance use, especially opioids and alcohol. Often illegal substances are used to cope with mental health issues, trauma, and life stresses. People develop habits that offer an escape from reality. For many, their reality is full of poverty, pain, and depression. In my practice, those that have substance use issues along with mental health struggles are generally characterized by poor attendance, emotional fragility, and treatment resistance. Now that we have outlined or surveyed the landscape, so to speak, I'd like to offer some interventions. The first one, managing expectations is key. Generally, if a substance works immediately, it's really not good for the long-term use. A challenge in my mental health profession is to manage expectations of patients that there's usually no quick fixes. Mental health, behavioral health takes time. Medication management takes time. Counseling, it takes time, as does lifestyle changes. They take time. People often become frustrated due to the length of time and lack of sudden results, and unfortunately often drop out of treatment, or worse, turn to the substance of choice for a quick fix. The impending guilt then often leads to more substance use, poor self-esteem, and unfortunately the cycle continues. I make it a point to underscore that progress is a long process. If someone reaps results quickly, great. However, be prepared for a slow process of change. This is often characterized by the phrase 3 steps forward, 2 steps back, progress. But there will be progress. When the journey is slow and methodical and the process is intentional, the results then are lasting. Healthy habits are formed. Neural pathways are engaged and solidified. Lifestyle changes are made that can insulate a person from future sabotage. James Griffith, chair of the Department of Psychiatry at George Washington University, has advocated resilience-based therapy for the people of Appalachia. Seems to work and be especially effective in traumatized populations. The idea here is to draw from the strengths of the people of the area, that they have close-knit families, a cultural emphasis on families, and to draw from their inner resilience. The takeaway is that through consistent dedication to treatment, specifically this aforementioned resilience-based type of therapy, that a person can develop robust skills, a mindset to deal with the stresses of substance use and living in the Appalachian area. Our intervention is medication-assisted treatment, or MAT for short. This is a divisive subject. Suboxone and methadone are very controversial in many parts of our region. Research demonstrates that MAT does save lives. It offers a context of support through counseling, encouragement, peer support, medical, psychiatric treatment. There is no perfect system for substance use. It's important to define what recovery actually is. One idea that comes to mind is to completely abstain from all substances, including prescription substances. This paradigm is certainly true. However, recovery can also reflect the use of medications to assist in stabilizing physical and psychological dependence in order that a person can participate more fully in their recovery process. Here are some facts. MAT saves lives. Research shows that the use of MAT medications like methadone, Suboxone, naltrexone reduces incidence of death related to opioid use disorder. MAT medications are less likely to be abused due to the chemical constructions of the medication. Also, due to the construction of medications like Suboxone, it is extremely difficult to overdose due to the built-in ceiling effect. Most overdoses in connection with Suboxone almost always have other central nervous system depressants involved. Misuse of Suboxone is not as prevalent as one would think. Because it is a partial agonist, it has a strong affinity to the mu receptor. Euphoria, therefore, is significantly less. It's not a substance of choice for those seeking pleasure from using it. It is mostly used on the street to control withdrawal symptoms. Another fact is MAT medications can be taken for a long time in management of opioid use disorder. Even though there is a measure of help provided in MAT, this should not be the only pathway to treatment. For instance, considerable efforts should and can be made into prevention of substance use by identifying causations and correlations and targeting these. There is a lot of work to be done. Our intervention would be improving the quality of life. Isn't this the goal of healthcare? Think of achieving this goal as a pie chart. Some pieces of the pie are bigger than others. Each aspect of healthcare represents a portion of the pie. For example, medications represent only a portion of treatment. Diet, exercise, they represent another portion. Spirituality, meditation, they can represent another portion, and so on. It's important to understand that some aspects of our health can only be addressed through specific interventions. For example, MAT medications can only address one aspect of recovery. Therapy and counseling may be needed to address trauma. That often triggers substance use. Additionally, engaging in spiritual exercises like meditation and prayer can help confront some existential questions that people often wrestle with. Incorporating lifestyle changes little by little can truly be life transforming and address substance use. Well, consistency. It is key. Most of us want to lose weight, right? Fad diets, supplements, 30-day workout programs are all well and good, but will never deliver long-term results. The simple formula is consistent daily habits, food quality and intake with increased lifestyle changes. It proves health, including weight loss. The same can be applied to substance use. You are what you do every day, not what you do now and then. Consistent therapy, medication management, consistent working on life skills, and paying attention to behavioral changes over months and years is the most effective plan of treatment. Final thoughts in summary. There is hope for Appalachia. Consistent positive change over a long period of time has a compounding effect. Please share this video, as the more people we reach, the greater impact we will have. Thank you.